Okay, we saw these pictures and we just had to find out more. Mobile vaccination team arriving last week in Haines Junction, Yukon, and the warm welcome they received from the community. Ice candles, bells, ringing, all sorts of excitement. Pretty heartwarming for sure as the mobile vaccine team arrived. So as I said, we had to find out more. So we've invited both ends of this story to join us this morning and to share it with you. We have Jane Boutet, who's with us, who's the manager of community nursing for the Yukon government. And that's, of course, people in charge of those mobile teams. And there's Angie Charlebois, who's the deputy mayor of Haines Junction. And they're at home in her community. Population, am I right on this, about 800, Angie?
Yeah, about 800.
About 800. Ladies, welcome. Really happy to meet you and really looking forward to sharing this story. And let me start with you, Jane, because I want to find out first about these mobile teams. I can only imagine the logistics of going community to community through Yukon. Tell me how you're working to get vaccines out.
Well, it's part of a really big effort with lots of partners. We've been really fortunate in Yukon to have great collaboration from our community partners, so local governments and First Nation governments. Behind the scenes, it involves a lot of managers and directors, people from HR. We've had an unprecedented number of people come forward to help, which has been incredible, but also very logistically challenging. And as you saw in the video, that was towards the end of our round one rollout in our rural communities. We had 2 mobile teams on the go who did
on buses. They bus around to those 13 communities on buses.
Bus and flight. So Old Crow was a fly-in community, of course, in northern Yukon, and then some of our other communities also have airports. So we had literally people in planes, on buses, and cargo vans. It was pretty incredible, and 13 communities in just about 3 weeks.
Planes, trains, and automobiles to get the job done. There we are,
That's
Jane.
Right.
And one of those 13 is Haines Junction. So Angie, you come in. We're going to bring up the map just so everybody understands. Population 800, where you are, and the challenges of getting to your village?
Well, to be honest, we have it pretty good in Haines Junction. We're close to Whitehorse on the Alaska Highway, and the mobile team was coming from a community just about an hour away. So they were also coming down or through the Alaska Highway into our town. So it worked out quite nicely. Logistically, I think we were probably a fairly easy community to get to and to service, but we are small, we're a little bit out of the way, and we're very friendly and grateful. So
well, we can see that already, because tell me, when you knew they were coming, what went out sort of through the community, what you wanted to do to greet the people coming to give you vaccines?
Well, it kind of happened towards the tail end of a council meeting. One of my council mates, Carrie Johnston, is on a task force related to the vaccine and the virus. And she said, it'd be really great if we did something to mark the occasion or something just to create an event. And of course, we're not doing events. And so at the end of the call, she and I spoke, and she said, can you handle this? I just have so much going on. And I said, what about ice candles? Something that people can do, something that the community can participate in, whether or not they attend in person at the time. It was cold that week, so we all just, we thought it was a great idea. It was very easy, low barrier, I guess, to participation. And so we had a number of community members. As soon as I posted on our little Happenings of Haines Junction Facebook group, people jumped in and they said, I'm in, I'll make some. And
so how do you make an ice candle? What do you do? Because we'll go back and look at this again as the bus pulled in. I just want to bring this shot back again. How do you make those?
So what you don't do is what I attempted to do the first time. So the way to do it is you fill a container. Ideally, it's an ice cream pail. Those big buckets. I don't have those, so that's not how the container I used. But you use a fairly large bowl or container. You put it outside when it's minus 30, which it was, and you let it freeze for about 6 hours or so. And when you bring it in and you dump it into the sink, the bottom part of the container, where it's the most frozen, where it's the least frozen becomes the top of the lantern. And so then you just sort of dig through and it cracks open. You dump out the non-frozen water. So you're catching it before it freezes solid.
Okay.
So
That is so
inverse.
interesting. That is definitely something that we've all learned this morning, except for obviously people like you who know. So then come
did
back.
not know.
Oh, now we all know. So come back then to you, Jane, because you happen to be there. We're looking at the pictures of here come the teams at the end of the day, and this is the greeting that you get. Now tell me about that moment.
Yeah, it was so incredible. If anybody listening or watching has worked in healthcare before, you know that a thank you or a recognition from a patient or from a community is the most rewarding and special thing. And it's really what grounds you in what you do and why you do it. And just that welcome from the community meant so much to that team. So many of the people on our team have been working behind the scenes or on the front lines of this pandemic since last February, March, always sort of responding and reacting. And now here we are doing something in prevention and in public health that's just so incredible and so exciting. And to see the community share that excitement. And what you may not know is the theme for Yukon this year for our immunization rollout has been, this is our shot, let's take it. And a focus on the light returning to Yukon. The days here are still dark, but they're getting lighter. And then just this gesture and image of hope and this light coming down the highway, our team getting off the bus. People were so moved, so touched, and just so appreciative of the community of Haines Junction and really of all the communities here who've just been opened their arms wide to us and said, how can we help? What can we do? So it's really, I felt like a real bonding experience for everyone.
Isn't that beautiful? I love to listen to you describe what you were feeling as that was happening. I didn't realize that was sort of the theme in all of that and how perfectly this dovetailed with exactly what you're trying to do. Again, Jane, coming back to you, or Angie coming back to you, sorry, in all of this, obviously what you tried to do worked beautifully, and they did feel appreciated. In your community, I mean, is there really that level of excitement about getting vaccination? You had yours yourself personally. Is this how eager Haines Junction has been to have this?
I would say fairly eager. I was worried, though, to be honest. A lot of the communication that I was receiving, from sort of the periphery was, we need everybody who is planning to get the vaccine. Oops, I'm sorry, that's my alarm.
It's going to tell you that CBC wants to talk to you on the air.
Yeah,
We do.
Don't forget to be on CBC right now.
Okay.
But I had this worry, this slight worry that potentially there would be people who were not following, reputable information sources. Mm-hmm. And having read that, people in the community who are trusted, who are friends, who are communicating directly and dismissing any myths would have an impact. So I was really hoping that, by being very present on social media, by being very vocal, by creating some excitement and enthusiasm, there would be a little bit of a social proof aspect to, a lot of us do want to do this. And when you see hundreds of candles lit and that people are excited, I think it does create a certain amount of inclusion. And so I was really hoping that our enthusiasm, for the many of us who have that enthusiasm, would be contagious. And our community does have a lot of people who live here, often retire here and stay here. It's very beautiful. I think the videos just capture a little part of how beautiful it is, but we have gorgeous mountains and really nice people, a lot of whom were previously, parks employees. They have a background in biology, or some of the retired nurses stay. So I was really hoping that there'd be a bit of a tipping point with the people who are, informed and I guess responsible for their health, that if they came out and they were part of it. We also have a business community. We're a tourism location, and we want to get back to business as soon as we can. So there's this part of me that thought, okay, if we really do welcome the vaccine team, we're showing our appreciation, which is very much heartfelt, but we're also demonstrating that we're all in. Like, we are doing this, we're getting the vaccine, we care, we appreciate the opportunity, to be honest. We're a small community. We in the Yukon have not had many cases, and here we are with this opportunity to get vaccinated
And
far
you
ahead
fully
of
took
other
it.
communities.
Fully and beautifully and quite movingly. And let me come back to you, Jane, for the last thought and all of that. Again, you can hear what was intended. Obviously, we've heard from you that it was very well received. What do you do now as far as continuing with vaccine in Yukon? I mean, what is the next challenge for the mobile team for you as you look to the future now?
Yeah, well, like everywhere else in the country, we're waiting to find out what our next shipments will be and confirmation of those shipments. We're slated to hit the road again on the 19th of this month, back up to Old Crow, and start round 2 all over again. And then we're simultaneously have clinics running here in Whitehorse. So yeah, it's a big effort ahead of us. We're all just hoping and praying that our vaccine arrives on time. And then we've just got our sleeves rolled up and ready to go to keep pushing out and keep bringing that life back to Yukon.
Wow. Well, certainly elsewhere in the country sharing that part of the supply question with you. Maybe not the great logistical challenges, but listen, thank you very much to you, Jane, and to you, Angie. Listen, are you going to get the candles out for round 2? You've set a bar here for the whole territory.
I've already been asked. I think I would do it again if I did not buy cheap tea lights. Okay. That's the trick.
That is the trick. All right, got to keep the budget too, even as you say welcome. Jane, Angie, thank you. Welcome to our program. A pleasure to talk to you both. Good luck with round 2. Thanks, ladies.
Thank you so much.
Thanks so much, Heather. Bye-bye.